Hello, my name's Alice and this is my short video on metformin and how it is linked and helps PCOS. So this video is for you if you have been recommended recently to start taking metformin and you want to find out a bit more about it, or maybe you've recently been diagnosed with PCOS and you've been doing some research into the medicines that can help you. It could also be for you if you're taking metformin and you don't actually know what it does. So perhaps you've been put on metformin but you're not 100% sure how it works and you've started experiencing some nasty side effects. So maybe you're being sick, or you feel sick all the time, or you're cramping and you've got sort of a really bloated belly. Maybe you're trying to conceive at the moment and really struggling and you're looking for a solution to that. Or maybe you've got severe acne and you think that metformin could be the answer to your problems. So if so, this video is definitely for you. It's also for you if you are interested in looking into some more natural therapies. So natural therapies that perhaps could work alongside your medication, or if you're not on medication and you don't want to go on medication, some natural therapies that could help as standalone. So that this video is also for you if that's what you're looking for. So before we go any further, let me introduce myself. So my name is Alice and I am a nutritional therapist specialising in PCOS and women's hormones. So I do this job more than anything because I want to stop women living in unnecessary pain and discomfort. So when I was in my final year of my nutrition course and I started to see clients, 4 of the clients that I was seeing just happened to have PCOS, and they all came to see me and they were so sort of downtrodden, upset, at their wits' end. They didn't know what to do. They were in a lot of pain, some of them for years, well, I think one of them for 7 years, and they'd kind of been fobbed off by their GP. They'd been given this diagnosis and not really given anything else other than, oh, you need to go on the pill, come back when you're trying to conceive. So I knew then that I absolutely had to help them, and that's when I became obsessed. Basically, I was reading all the research papers, all the books, all the science, and started to work with these women, introducing ways to help them quite quickly. And I think that they were shocked at how quickly diet and lifestyle can impact their symptoms. So the first point of call is always to find out what's driving the symptoms, and then as soon as you found out that, then you can start to work pretty quickly to start to manage them and see some quite severe results in a quick period of time. So let's go straight to the point. What is metformin? So metformin is a pharmaceutical drug. It is most commonly used for patients with diabetes and patients who have problems with their blood sugar. So you may also heard this referred to as glucose intolerance, insulin resistance, hyperinsulinemia, all things and phrases that kind of get thrown around with patients who have diabetes. But there is a big link with your insulin management and PCOS. So I'm going to give you a bit of a science lesson here. So insulin is the hormone that is released by your body to manage the amount of sugar in your blood. So metformin helps to reduce insulin resistance, and insulin resistance is how responsive your body is to the insulin hormone. And it also improves hyperinsulinemia, which I mentioned earlier, and that is when the amount of insulin in your blood is too high. So one major statistic is that 65 to 70% of women who have PCOS have some form of insulin resistance. So that could be sort of fully fledged, comes up on a blood test straight away, and it's really super high, or it could be really early stages, which is quite common. So you might have the symptoms of PCOS, so the irregular periods, the acne, the cysts on the ovaries, but it might not be that your insulin resistance is picked up yet. That doesn't mean that you're not sort of on the way there. So it's always a really, really good place to start when you're looking at what is driving your PCOS. So How does metformin work for PCOS? So like I just said, 65-70% of women have some form of insulin resistance, which could be driving their PCOS symptoms. So metformin will improve insulin resistance, and it will also reduce the amount of insulin that is in your blood. So this in turn will reduce your androgen levels. So your androgens are your male hormones. You may have been tested by the doctor for testosterone. There's also DHEA, and having high testosterone, so as a woman we're meant to have some testosterone, but having levels that are too high can cause things like facial body hair thinning on top of your head, the acne, especially around the jawline, and lots of other symptoms that are really nasty and really difficult to live with. And in some women, metformin can help improve your cycles, so regulate your cycles, bring your periods back, and improve ovulation. However, it's not recommended as a first point of call for these things. It's more to manage insulin resistance. So why do doctors prescribe metformin? So we've already kind of gone through this. Metformin really helps with insulin resistance. Although, as I noted earlier, sometimes very early insulin resistance might not be picked up. For example, you might have had your HbA1c tested, and you might have seen those results come back from the doctors, and they might look normal, because it's quite difficult to pick up very early insulin resistance from those tests. A more gold standard would be the oral glucose tolerance test, for example. I had one of those when I was pregnant, just to check that I didn't have gestational diabetes, and it's where you sort of drink a sugary drink, and then they check your blood sugar spikes over 2 hours. So if you have insulin resistance and you have high testosterone, the doctor will prescribe metformin usually, and this will in turn bring down your male hormone levels. Also, it has been seen on some studies that if you take metformin 12 weeks before conception, it can help reduce early miscarriages and other really nasty pregnancy complications. So that is definitely a positive. It's not clear, however, whether metformin should be used as a first line of therapy for all women with PCOS. So only those women who are showing signs of insulin resistance. Also, in really rare cases, there is something called lactic acidosis. This is usually with diabetic patients, but it's just a build-up of lactic acid in the blood. So that is another potential side effect. And then taking metformin is considered relatively safe if you become pregnant, but that is something that you need to discuss with your doctor. So probably one of the most common questions that I get asked is if there are any natural therapies that can support PCOS and that can kind of do the same thing as metformin, either to work in conjunction with or as a standalone. So the number one product is inositol. So you've probably heard of this if you've been doing some research yourself, and inositol is actually a sugar. It's sometimes referred to as vitamin B8, although actually it's not a vitamin. You can find it naturally in foods, so things like citrus fruits, cantaloupe melon, fibre-rich foods like sesame seeds, brown rice, beans. You can find it in abundance in those foods. So inositol can also be taken as a supplement, and there's been quite a few studies now that show the positive impact it can have on insulin resistance, as well as ovulation, sort of restoring hormone imbalances. It can help to reduce BMI, regulate periods. There's lots and lots of different effects that this inositol can have on the body. And studies show that inositol can be taken as a standalone or as a combination with metformin. So there are two different types. There is myo-inositol and deutero-inositol. So again, studies show that when taken in combination, these actually are most effective. So you'll probably see when you search that they'll have both on the label. There's also studies to show that when you take both of them with L-methylfolate, which is a much easier absorbed form of folic acid, and is probably the folic acid that you should be taking if you're trying to get pregnant, that taking those three together can be really, really effective. So that is my short video on metformin. I hope it's helped to answer some of your questions. Feel free to ask me any more that you have. I just wanted to remind you that I'm not a doctor, so if you are taking metformin or you want to take metformin, this can only be prescribed by a doctor, and I would recommend that if you are going to start taking new supplements, if you're taking lots of different supplements and medications, it's always best to check with your doctor, because interactions can happen even with natural therapy, so that's really, really important to note. So yeah, let me know if you have any questions. I hope that was helpful. Thank you.